So neuromodulation is becoming important, at least in the US. I think some of the modulators we have in the US are available here in Europe as well. Some of them are not yet available, but will be coming. Well, one of my favorites is Nerivio, which I don't believe is here yet, but will be coming, but quite popular in the US. And it's a neuromodulator that you put on the upper arm, and it gives a stimulus which can be controlled by the patient on a smartphone. So when they feel something that's a little unusual, they turn down the gain slightly so they don't feel it anymore. And that sends an impulse through the central nervous system way up to the brainstem, which activates the brain's own descending system to modulate pain. It's almost like magic, but it really isn't magic, and it can be very helpful. There are 4 other neuromodulators which are also being used. Some of them are for acute care only, some of them are for prevention only, and some are for both. The one I just mentioned, the Nerivio, is for both, and it can also be used in adolescents, age 12 and up. Many of my patients say, I don't want side effects from drugs anymore. I'm taking too many medicines. Do you have something that isn't a medicine? And these neuromodulators are not medicines, and they work very well with very few side effects. So I think you'll see here in Europe that we're going to have at least 5 and maybe more neuromodulators, which are quite safe. And so we will have so many good neuromodulators, acute care medicines, and preventive medicines that everyone will have the same problem I have. I don't know which one to start with sometimes. And that's a good thing for people with migraine.